this is Muskegee, land of medicines. It's almost like we were born to do this, born to be the land of medicines, born to give back, to create a space for healing. And it's truly honoring what I would say is the treaty relationship of the medicine chest, and moving forward together to highlight healthcare, mentally, physically, emotionally, and spiritually, along with all Canadians and Albertans. It's what we want to be known for.
It has a very entrepreneurial culture. I mean, look at what's been done here. Look at the casino, look at the hotel, look at the businesses that have been created on the reserve. I mean, there has been an enormous amount of activity here in a very opportunistic but entrepreneurial way, but to a very high quality. So I think the nation has a tremendous track record and can do really great things in health. When we've talked to healthcare professionals about working, on Enoch Cree and even Sovereign Health, I haven't had anyone who's not excited, really excited by the prospect of doing things differently and being in a different place to do it. So I think it's a highly attractive environment. And people look at Enoch Cree and Sovereign Health as a really, really exciting thing.
We are in 3 provinces with 7 clinics and we are probably the biggest in Canada, but certainly in Western Canada, in providing day surgery for the health regions across Western Canada. So you can imagine the amount of impact we've had on 500,000 patients. And we have been very slow in our growth. We've been very calculated in our growth, but yet 500,000 patients have had the benefit of having the surgery with us.
We can move faster in terms of construction, innovation, regulation in terms of partnership in a good way. I'm not compromising quality at all, but we can move faster in terms of, again, that construction and thinking outside the box and being innovative and not being stuck in huge bureaucracies or institutions. We can move really, really fast as an advantage. There is no moving forward without First Nations people in today's Canada. Whether you're in the resource sector, whether you're in the education sector, or whether you're in the health sector. And at the end of the day, the identity of Edmonton, the identity of Alberta is going to be shaped in a big way going forward. It already is with First Nations and Indigenous Métis peoples. And so why wouldn't we want to have a partnership with healthcare? That is the differentiator. There is nobody else bringing that to the table in the capital or Calgary region at this time.
The cost situation is very, very difficult. You want to work with groups who can lower costs but maintain quality, and looking at the way Enoch has used, business principles in these other areas, applied them to hotels, casinos, other businesses, looking at how that, can influence the development of new health services. I think that's a plus. The bonus is it comes in a culturally sensitive way, so there's no losing this. Everyone can look to, to a benefit.
We also work with the surgeons to make sure that the equipment that they need to get the best results are always there. So we do not treat patients as patients in particular. We treat them with a lot more respect. They get the personalized care when they come here, instead of just being one of those that just goes through the system.
I think the opportunities that are shown through Enoch Cree Nation, through Sovereign Health, are amazing for the healthcare system. We can learn so much by working together, delivering new services for First Nations people in a way that's never been done before, that respects culture, that delivers high quality services, that allows innovation, allows education. It's just a great opportunity, and I'm here as a basically unpaid volunteer. I have no stake in this, other than this is the right thing to do. I'm really excited about moving forward with this.
We have a great MOU with AHS, and it's written in the principles of Nehial Pamatsuin, the Cree way of living. And I'm so happy AHS agreed to that. And it's to ultimately do what we agreed to in treaty, is work together for healthcare for us and for all Canadians and Albertans. But it can't just be a piece of paper. It can't just be a grant, another grant to look at, another program for another, just maybe a smudging room or something like that. Can we take it to another whole level, celebrating and doing something really innovative? And I say, why not? Why not? We already have this partnership with AHS. We already have this great relationship. We have the expertise, we have the land, we have the capacity, and that's collectively as both partners moving forward together. So why not a surgical center together? There is absolutely no reason that we can't get it done.